Yes,
You are 11 days out from your Jiffy knee on the left side. How are you doing?
absolutely miraculous. That's the term I've been using since Saturday the 18th
Yeah.
with to my family.
Um, so a few questions. How long were you having to take narcotics for after surgery for the
I
pain?
took a Percocet. My daughter asked for a Percocet for me to ride home with because it was an hour and a half away.
Right.
I took one that night. I didn't take anything Saturday. And then Sunday, no, I took one in the car on the way home. She gave me one Saturday as a precautionary because I had to get on the bike.
Right.
And she gave me a half.
Okay.
Sunday, then I stopped.
So basically a day or two of narcotics after surgery.
Yeah.
That's fantastic.
It was kind of scary.
Right.
Yeah, because I had the other, and it was my daughter's like, "Are you in pain?" I'm like,
Yeah,
"No."
so you're in a unique position because you had a traditional knee on your
Yeah.
right knee, and now you had the Jiffy. How is the
Exactly.
experience different as far as post-operative
Totally
pain?
different.
Yeah,
With the right knee, I was on around the clock narcotics. He said to stay ahead of the pain and
right,
don't fall. So my daughter was giving it to me every 6 hours because I could start feeling the
right.
throbbing so that I wouldn't. So for 7 consecutive days, that's what we were measuring this
Right,
against.
I
She
got
had
you.
me around the clock.
So just significantly less narcotics.
Exactly.
And how are you doing in therapy? Because today, 11 days out, just see how you straighten your leg out. Full extension, almost back to complete zero, and you have about 110 degrees of flexion 11 days. That's fantastic. Is the
Wow.
rehab faster?
Oh, it absolutely is. When I went to rehab, I had surgery, excuse me, on the 17th, rehab on the 20th. When I got in and she had me lay on the table and she said, "Try and bend your knee." And I bent my knee. She's like, "Oh, excuse me, when did you have surgery?" I
That's
said, "On the
awesome.
17th." She said,
That's
I said,
fantastic.
"It's this new thing. It's called Jiffy." She said, "I never heard of it. What do you mean Jiffy?" And I explained the process to her, right?
Right.
And the therapist was so impressed. She said, "I have to get the information from my other family." She went and told the other therapists. They came over.
That's fantastic. And then I noticed that 11 days, you're not using a walker or cane. How long did you use a walker or cane for
I
after
used the
surgery?
walker. I took the walker with me to my first therapy session on Monday the 20th. Took it on Wednesday the 21st. She told me, "Don't bring that walker back in there."
Perfect. 5 days of using an
Yes,
assistive aid is
exactly.
fantastic. Just show us how you can stand up from a chair. And then just show us a few steps. How are you walking?
I start off like a toddler,
You
then I
start
go
off like,
into the adult.
and then it loosens
Adult,
up. And
yes. Uh-huh.
amazing, amazing,
Yep.
fantastic. Ms. Gilkey, great job.
Thank you so
I'm
much.
so
You know
happy
you're
for
my
you.
hero.
I appreciate that. I appreciate that. You
Thank
take
you.
care.
All right.